Hi guys, this is John Adamson, the Rehab and Documentation Guru. Going to talk while I'm driving, and you might hear an angle on the camera, and that's because I've got it on my little magnet holder on the car. Now you get a chance to see my car with no headliner, just the cork showing. It's an old car I use for home health because I don't care about the mileage on it, and the headliner was coming down, so I just pulled it off. Today I wanted to talk to you about something that I don't do, and I would encourage you to consider not doing either. And that is, I never assume that the last healthcare worker that looked at my patient thoroughly looked at the patient. So as you know, or if you've been following my channel, you know I do home health. And in the home health setting, each visit you are the only healthcare worker, and so you want to make sure that you're doing a thorough job. And there are some fail-safes built into home health visits. For one is the mandatory assessment of medication changes and the mandatory assessment of pain. Those are fail-safes that even care workers that do not provide treatment in those given areas are at least assessing if there's a potential problem. There's other things that I do that are not necessarily mandated. For one, I always ask the patient and or caregiver if the patient has had a fall since the last visit. As far as I've seen, that's not a condition of participation for home health. But I glean all sorts of information from that. And I tend to ask some other questions that are not necessarily physical therapy related. Now, why do I do that? Because I assume that other care workers are not necessarily doing a thorough job. For example, I think you could all relate to this. How many of your patients have complained that the doctor spent maybe 5 minutes, maybe 10, assessing them, and then sent the patient to you, and then you find out as a PT, OT, or speech therapist that they really should have gotten another referral based on your knowledge of the scope of practice that could have impacted the patient problem. And this happens to us a lot. So we really owe it to our patients to make sure they get a thorough assessment, because sometimes somebody missed something and that could cause a bad event or at least insufficient care of the patient. The other thing is, I don't always assume that my patients, especially geriatric patients, are telling me the whole truth and nothing but the truth. So I regularly involve the caregivers. I think in home health we do that anyway, but we want to get other perspectives from other people, even if the patient seems fully with it, cognizant. I'll give you an example. I've got a patient who I know is not cognitively intact, but the wife of the patient is clearly stressed. And when you're stressed, you don't always make good decisions. And sometimes you have cognitive impact yourself based on stress and depression. And the presentation and the information I'm getting from this particular spouse, when I talk to the patient's daughter, is wholly inadequate. And it's pretty clear that there's some significant concerns going on that the spouse is covering up for. So I'm glad in this particular case that I've done my due diligence in asking key questions to other loved ones in this patient's life to get a more accurate and full picture of what's going on. That's just going to make me a better clinician and it's going to help me guide towards more appropriate referrals for the patient that are clearly needed, because the picture I'm getting from the patient and the spouse are not adequate and potentially are putting this patient at risk. So anyway, the purpose of this video is just to encourage you to consider being really thorough in everything you do, looking for opportunities that other care workers might have missed, and of course, doing your due diligence in getting as much information from every available source, including outside the immediate family, on your patients, to make sure you're meeting every single need that your patient has. Anyway, this has been John Adamson, the Rehab and Documentation Guru, encouraging you to do a thorough job, as I know if you're probably watching this video, you're doing it anyway, so I'm probably just preaching to the choir. Anyway, take care, God bless, and thank you for putting up with the funky formatting of today's video. Bye.